In this video, we are doing a 3-vector lift as well as a jawline thread. For this patient in particular, I chose to use Arte 3 70 gauge by 100 millimeter threads. But right here, I am just checking to see where I am getting the best lift and then going ahead and choosing my initial starting point right along the patient's zygoma. And then I am choosing my endpoints. We always want to make sure that we're going all the way past that deficit to not only give the best lift possible, but to also make sure that we don't have any thread visibility when the patient is animating. So I'm just going ahead and marking where I want to go, and then I will be marking my antegonial notch just to know where my facial artery is. We should always be aware of where we are in the face. Even though for lifting threads we are above all major vasculature, we still want to obviously be aware of our surrounding anatomy. So there I am just checking my lift again and having the patient clench down and feeling her masseter. Typically we can find that antegonial notch right anterior to the masseter muscle, and just going ahead and marking that off. This is going to be my jawline vector. This patient was cleaned with HIPAA cleanse and alcohol prior to marking the patient up, and now we're just going to go ahead and get started. So in my syringe here, I'm using a ComfortTox 0.5 ml syringe, and I have lidocaine with epi. Just for my initial pilot hole, it just helps with bleeding and just makes life a little bit easier as we're going in here and placing our threads when we don't have as much blood dripping. So I am just going in with an 18 gauge needle into each one of my vectors and just moving back and forth slightly. I don't want to cause, too much tissue trauma here, but I do want to make sure that my pilot hole is large enough for my 17 gauge thread. Now I'm going in with a cannula. In this syringe, I only have just plain 2% lidocaine. I don't really like to use epi for my tracks because we are putting quite a bit. I like to put either 0.5 or even a little bit less of lidocaine in each vector. We don't want to have too much fluid, otherwise that thread is going to have a difficult time engaging. But I just slide down and find my correct plane and then just go ahead and give a nice thread of lidocaine just to help with the discomfort. As you can see, the patient looks pretty comfortable. She tolerated this very well. And I always tell patients, lifting threads look, very invasive, kind of scary. However, it actually tends to be one of the more comfortable treatments. If you are in the correct plane, it tends to be pretty comfortable. And of course, we're using some lidocaine as well. It's more of just a different feeling. I kind of describe it as almost like a creepy crawly feeling. They kind of feel that cannula moving through their tissue. It's not necessarily painful, it's just an odd sensation. So now we are going in with our first thread. As I said earlier, we're using 17 gauge, so you do want to make sure that you have a large enough pilot hole. And then I am just going ahead and giving a nice pull back and feeling those barbs engage as we go ahead and pull back. So as you can see, we're getting a really nice lift there, and we're just going to go ahead and do our next thread. I like to lift from top to bottom just so I can appreciate the results that we're getting as we're going along. So here I'm just going all the way past the marionette line and then going ahead and just repeating that same process. I like to make sure that I feel that thread engaging before I come out, just to make sure that we are actually getting a good lift. Here I am just going into my jowl vector, my last one on this side. So again, just following that thread out, making sure I'm feeling those barbs engage. And then I'm just going to go through and smooth a bit and just make sure there's no barbs that are still yet to be engaged. And then I'm just kind of appreciating what kind of lift we're seeing here and assessing whether or not I want to go back in with another thread in any one of these vectors. But I was happy with that result, so now we are moving on to her jawline. As we can see, I'm slightly behind her antegonial notch there, and I actually really like marking my jawline prior to doing my 3-vector because you can actually really appreciate that lift already by how my line is now not straight. So it's actually kind of cool to see how we are already seeing that tissue lift. So again, I just went in with my lidocaine and with my 18 gauge needle, And then going ahead and repeating that same process by using my cannula to create my path, and then placing a little bit of 2% lidocaine for comfort. And then we will go in with our last jawline thread. And we will really be able to see this lift here and really appreciate our results once we have this patient sit up. So here I am going in with my last thread. The jawline tends to slip in pretty easily. We're just going in a straight path. Again, just making sure that I'm all the way past that area of animation and going ahead and following that thread out. Here I am just, again, making sure there's no barbs that are yet to be engaged, and I have an alcohol wipe there in my hand and just cleaning over that initial pilot hole prior to putting a Band-Aid. I want the patient to leave the Band-Aids on for the rest of the day. They don't have to apply anything the following day, but I like to make sure that site is covered and clean, at least on the day of treatment. So again, I am doing the same thing along the jawline, and then I'm going to go ahead and place a Band-Aid. The barbs are bidirectional, so you do want to push both directions to make sure everything is nice and smooth prior to the patient leaving the office. But you can already see how nice her jawline looks there, and then we'll go ahead and have her sit up. And you can really appreciate there her nasolabial fold, and especially along her jawline.